Good evening, everybody. Good evening. This is Derek Terry, and I am joined by my two lovely hosts and my dear fraternity brother. We have Tony Breedlove, Shar Ann Tappan McCabe. You put the whole name on there. And Reggie Kearney. How's everybody doing?
Stressed,
I'm doing fine. How you doing?
very stressed.
Okay. Getting ready for my 2 day telework week, but outside of that, I am fine. And
We didn't ask.
tonight we what you say? Oh, that's right. We didn't hear from you, Tony. I'm sorry. Go ahead.
No, I said we
You were
didn't
kind of
ask
delayed.
you how you were.
Start again.
We
I had to
didn't
turn down my
ask
volume.
you.
I hear a delay for some reason. I hear like I don't know who's it coming from.
Keep going.
Okay. I just hear it. I don't know. But anyways, tonight the coronavirus. Well, we're gonna talk about something a little bit different of what we call COVID-19, where we know it's not only affecting humans, but it's also affecting us from an economic level. People are fearing the coronavirus virus and feeling the impact as we look at the global economy. It is what it is. And it's definitely, if you're in the market, it's affecting you. If you're not in the market, it's somewhat indirectly affecting you. And you see where the stock prices go down as well as the bond yield. So when we talk about Chinese and how it really affects us, we get a lot of our products from there where we're talking about electronics, we're talking about clothing items and things of that nature. But there are close economic links to China, which focus on Asia Pacific countries such as Vietnam, Singapore, South Korea, and of course the US. And with a rapid spread of the coronavirus, global manufacturing activity could be somewhat damaged or hindered for a couple of months or maybe a year or so. We really don't know. So, what we're going to talk today is how the coronavirus is affecting not only in our community, but your community, because economics drives everything. But even with economics, there are things that are affecting coronavirus, such as schools. We have even the election, where those is hurting those particular items, but it's also affecting entertainment industry. It's affecting healthcare industry. So there's a lot of things that the coronavirus is affecting that some people didn't really want to take that seriously. And now, like I've said the last show, things are real fake until they start to get real. So before me, Reggie, and Shar get into it, I want to actually hear from Tony because I hear the stuff and see the stuff on the news when they talk about Vegas. But because Tony lives in Vegas, I'm curious of what coronavirus is doing economically in Vegas.
Well, I think if if you know Vegas, the hotel, the casino, and resort industry is the biggest part of the city's and even the state's revenue. That's their revenue stream. As of Sunday, it came down that MGM was closing all of their properties, which happened to be about eight properties. So with those eight properties shutting down, you've got you know nearly 100,000 people who are going to be out of work for we don't know how long. But what you don't see in the news is what it looks like. Uh, I think everybody has the idea of what the strip looks like. It's always crowded. There's people all over the place. There's traffic. The cars are, bumper to bumper. I mean, it's always that way, no matter what day of the week. Well, right now, the strip looks like a ghost town. Um, I work in the industry of transportation, transit, city transit. And the organization that I worked with for the last 5 years, they are the ones who are contracted to run the transit system on the strip and even the neighboring areas, which is basically residential service in those areas. That organization was told by the commission, Transportation Commission here, that they had to cut back 50% of their service. And what that does is those who are still working on the strip, that their hotels have not shut down, now they have a hard time getting to work because there's no transportation going into the strip area. But as I understood just recently, as of yesterday, there are other hotels that are following suit. Caesars, being the biggest, is looking to shut their doors. And then you've got all the other smaller casinos and hotels who are shutting down. A lot of people wouldn't know that even though that the strip is the biggest draw, you've got millions of people here, and they don't have viable transportation as of right now. Today I did get word that the DMVs, because they are state mandated, it has been told that the state or people that are working for the state or all those entities are closing down. That includes the DMV. So that means that as of Friday, the DMV will not be operating, which means now my job might come to a halt because I depend on the DMV to be able to put people behind the wheel of these buses. They need CLs. They need CDLs. And if they can't get permits, if they can't go update their medical or DOT and all of these different things with the DMV, then our organization shuts down. So it's it really looks bleak because now you've got all the grocers who are running out of food. It's bleak, so it's impacting Vegas more than what you see in the news. This entire town runs on the hotel industry. It literally runs on the hotel industry. So
yeah, and that, like I said, I would definitely appreciate that perspective because for anybody who has not been to Vegas, my first time going to Vegas was last year, and I was just overwhelmed of everything that I saw. So if I visualize that picture in my mind and do the total opposite, I would be in shock. So it's definitely we definitely are feeling it. Not only where we're at, but Vegas, we have some similarities. We have some definitely a lot of differences when it comes to how it's impacting. But either way you look at it, it's still impacting. And those are just things that is going to vary from city to city, state to state, town to town. But the effects are real. So definitely appreciate that perspective.
I mean, but it doesn't matter, I don't think, how you compare cities. I don't even think comparing cities at this point. I just don't think.
I wasn't comparing cities. What I'm saying, I wasn't comparing cities.
But I think that no matter where you live, you are affected by this current crisis. You're affected. It's just so
that's what I said. I did.
Yeah. But people know Vegas, and like you said, your first time visiting here, you saw how Vegas is, and that's the way it is all the time. But now, nothing. Driving in on the freeways in the mornings, I get to work in 15 minutes, where usually it would take me 30. The schools are shut down, the stores are running bare. It's just like, and it's not chaos. I don't want to put that picture in anyone's mind. But if you can just imagine some of the old movies that we had seen in the past, like Pandemic, or what was the other one?
Contagion.
Those stories are actually true to life of what's going on that I can see here in Vegas. And it's real. It's real.
All right, so Reggie, and so we live in the same area, so I'll probably touch on what he doesn't touch on. But how, what are the effects that we're feeling out here in Charles County or DMV, or what have you seen? And it could be personal as well, as far as the economic impact that coronavirus unfortunately is creating.
Well, I know it's definitely a major concern of everyone in this area and everyone in this nation, but I also feel that we, as individuals, have allowed it to really take over our lives as far as uh, overreacting. I think we've overreacted to a certain extent when it comes to the economic side of it, especially when it comes to shopping. I've been in the retail business, all my life, and I know the inner workings of the retail industry, and I know that guys are in there to make money. Um, the supply chain, what I see is happening now, the supply chain has definitely been hurt by all the hoarding and panic buying that's taking place. And it's going to take a while for the basic staples to get back into the stores because of the manufacturing issues that are going to take place. When you talk about you have a number of retailers in this area that sell groceries, and they everyone pretty much buys from the same vendor. It's going to take a while for that pipeline to open up again. Now, I think one thing is going to happen going forward. You're going to see less of the private label brands and more of the name brand product going onto the shelves, because basically what happens when it comes to private label, the manufacturer sets aside a number of items, part of the production to do private labels with for the company to make it easier for people to purchase a cheaper brand. And I don't see that happening for a while. I think you're gonna see a lot of name brand. I think you might see the prices tick up a little, not get price gouging. And the same thing comes with
Okay.
meat and produce.
Question.
Yeah, it takes a time. It takes a while to get the market going again.
Okay. Yeah, and we'll definitely go into more detail. Now we have our New York City representative. So how's it affecting you or the area in which you're in?
Oh boy, and you'll have to forgive me. My throat's a little sore, but New
Uh-oh.
York is. I'm not coughing; it's just sore. um, New York is interesting. Obviously, as I'm sure you know, the mayor and the governor. Where do I start? There's so much going on. I've been reading about this every single day for the last 3 to 4 weeks, working on business contingency plans, emergency plans, corporate memos and correspondence to clients and staff. So I am knee deep in COVID information. And today, the governor and the mayor announced some initiatives which should help the city, both in terms of mitigating the spread and exposure, as well as addressing some other issues. For example, as you know, to mitigate risk exposure, they've closed restaurants, they've closed bars, they've allowed them to do takeout business only. All entertainment venues are temporarily closed. Broadway plays, football, basketball, hockey, all of that has stopped for the time being. The mayor and the governor have been actively, strongly suggesting that companies allow their staff to work from home. Now, if you work in an office, a high percentage of people can actually work from home. But in terms of economic impact on a personal level, all the people who work in that restaurant industry and the bar industry are going to have a difficult time paying their rent and paying their bills for the next bill or, next month or two. And that's going to cause a problem. So, the stimulus package that Trump is supporting now, and I've got a whole nother opinion on that, may help people if that money can get to them fast enough. The streets are a little more empty than usual. I wouldn't say 9/11 deserted, but on the way home today, I think I saw 5 people on the train, and that's very telling. People are deeply concerned about this. As we look at the New York State Department of Health website, which up until this morning was actually posting figures about new cases in the boroughs and in the counties, including Westchester. We've been seeing the numbers go up exponentially every single day. And I think we've now hit over 1,000 cases in New York State. and 75, I think in the country it's 75 fatalities, 7 in New York. But the concerns that we have are that every single day, since they're still studying this virus, the information is changing. The recommendations are changing constantly. So before it was, if you have flu-like symptoms, go to the hospital, go see your doctor. Now they're talking about triage because they're expecting a massive surge in the hospitals. So they're telling people to stay at home. If you feel any type of symptom, stay home for 3 or 4 days. And if it doesn't pass, then call your doctor, which is contrary to what the CDC was saying, because you can remain contagious and appear to be healthy. You can be asymptomatic and appear to be healthy and go out and still spread this virus because of the 30-day shedding period this has, as opposed to the 2-day shedding period that the flu has. So in New York, everybody I talk to wants to work from home. They don't want to get on the train. The city has suggested people stagger their commute so they can avoid being on the train during rush hour to and from home. If you're driving to work, they figure that your exposure is mitigated, so people still expect you to come to the office. But every single day, this is escalating to a new level and a new level. And this morning, the mayor of New York City, de Blasio, suggested that there is a possibility that they're going to make an announcement within the next 48 hours that New York City citizens should shelter in place, which basically means no more commuting, stay home for a 1 to 2 week period, in the hopes that this will help stop the spread in New York City. And people are freaking out about that.
Well, I know, like, for me, and I guess I'm in a unique situation where I work in Arlington. I live in Maryland. So where I currently work at, we have the option to telework, and because my wife is asthmatic, I chose to work, at least 2 days out of the week telework, which would be tomorrow and Thursday. So, and that may change, but as of right now, that's where it's at. And so, to some degree, it has not directly impacted me yet, but to a degree, it directly impacts me when there's people that I know that I see where it's directly impacting them. And on 2 examples, I know 2 business owners, and they're in a jam, just like any other business owner, especially restaurants. I know the governor of Maryland imposed, put through that basically if you have a restaurant, only thing you can do is carry out and delivery. So that hurts a lot of dining establishments, but I can understand the sense of urgency and the decision he had to make. Unfortunately, those businesses, they're going to be struggling if they're already struggling. And, and it pains me to, especially people that I know, to see them in that situation, because I know what it's like to have a business that you put your heart, your blood, your sweat, your tears into, and then you have to give it up. And, and I had to give, mine was years ago, I had a gym, but I had to give it up, and it hurt. But, I find comfort in knowing that at least my business, a good friend of mine has that business, him and his wife, and they're doing great things with it. But when you talk to some of these restaurant owners, in particular 2 that I have, they have to make some life-changing decisions.
Yeah.
And you had mentioned the $1 trillion stimulus package. It doesn't necessarily mean it's going to get to them right away.
No.
We don't know the stipulations to it. Does that mean that everybody gets it? When they talk about this $1,000 cash for everyone, if you owe taxes, are you going to get the $1,000? They might not give it to you.
Of course they will.
What if you're in the rear when it comes to child support? Well, I'm just going to give you $1,000. And, what if people file bankruptcy? And then, as we mentioned bankruptcy, I know some that said that they may have to file bankruptcy. And, we're looking, when you look at the virus, we're looking at it from a health standpoint, but a lot of people don't understand the economic, which means that economically that could hurt your health, or versa, if that makes sense. Because when people start stressing out because they can't pay the bill,